Hey guys, you're back again, and I'm so glad you're here to join us for what I think is a pretty fun episode. In this episode, I sit down with Dr. Dana Varble to discuss what's right with the veterinary industry. Now, I want to give you a heads up. The formatting of this one is a little different from what you guys are used to in these episodes. There was no formal outline, no scripting. Truly, Dana and I were just excited to be in the same room together. It had been a while, and we got to talking about vet med, how things are going, and we decided to just turn on the microphone while we were chatting. So what you're listening to is two veterinarians just chewing over some of the positive changes we've seen in vet med over the past several years. Let me remind you about the fantastic Dana Varble, and then we'll go ahead and get into our chat. Dr. Varble earned her bachelor's degree in zoology from Southern Illinois University and her DVM from the University of Illinois. While completing her DVM, Dr. Varble pursued a non-traditional clinical rotation schedule, fulfilling her academic requirements at a variety of alternate locations, including the University of Tennessee, Louisiana State University, Brookfield Zoo, which I will remind you, back when I lived in that area, was one of my very favorite places to visit. I highly, highly recommend it. Dr. Varble also completed clinical rotations at the University of Pretoria in South Africa. She has a background in clinical medicine, including exotics, small animal general practice, and emergency medicine, and still practices part-time, picking up relief shifts, as well as working at Chicago Exotics Animal Hospital in Skokie, Illinois. She's a national and international speaker in the field of herpetological and exotic animal medicine and surgery, and has authored several publications in that field. In keeping with her interest in organized veterinary medicine, Dr. Varble served on the board of directors for the Association of Reptilian and Amphibian Veterinarians and was president of ARAV from 2012 to 2013. She's also a member of the American Veterinary Medical Association and the Association of Exotic Mammal Veterinarians. She joined NAVC in 2015, where her role has continued to evolve, and in 2020 she was named Chief Veterinary Officer for NAVC. She shares her home with 4 ball pythons and, her words, a mixed-up brown dog named Hannah. And let's go ahead and get into it. I hope you guys enjoy. All right, so we are podcasting today about positivity, and I'm joined by the one and only Dr. Dana Varble. Hi guys, Chief Veterinary Officer for NAVC, and we're just going to talk about, what's right with the industry. We spent so much time talking about what's wrong with the industry, but we were talking about the other day, I went to do a house call, and I was at a client's house, and I spent a good bit of time there. Just lovely, lovely people that I was happy to see. And I got back out to my car, and I, of course, had like the long string of text messages of like, this dog has diarrhea, and this one is limping, and all this. I'm going back through and I'm returning the text messages. And I just thought to myself, I was like, this is just like an example of the very best of humanity here that I'm talking to. Just every single one of these people are absolutely wonderful that I'm so lucky to have as clients. And it really kind of put me in a positive state of mind where I try to stay because it's not always like that.
No, it's not. But those days they're important, right?
Yeah, you gotta hold on to those.
Yes.
Absolutely. So this positivity mindset. And then, so we got to talking and landed on this, what's right with the industry? What have we seen in recent, the last year, the last decade, that's good for the industry?
Because there's a lot more than, I don't know, there's still more good than bad.
I would
feel like
100% agree.
I understand some people, it's tough because you hear about people and, some of our colleagues in really bad places, and obviously your heart goes out to them, but you still talk to vets and like they're still like, that's kind of bad and that's kind of bad, but most of us don't have like, majority of our days are still good, or maybe part of a day is bad, but the majority of the day is good.
You can find the positive.
And it's hard sometimes because obviously squeaky wheel gets the grease, so the complainers, the yellers, they sit with us, they dwell on us, they kind of can ruin things, but
I think when you really sit back at the end of the day, you get that client, those couple of clients that are the squeaky wheels, they're the ones that want to yell and throw a fit, make a scene. And those can really take a toll. Like you said, you dwell on those of like, oh my gosh, and today was just horrible. But when you really take it back in hindsight,
most of them, I'm not going to say all of them because some of them just truly are horrible. But I would say the majority of the days I tend to be able to pick out more positive than negative in my day, even if it's like every dog was super sick and people were unreasonable. Usually like my team, you know, I find positivity with my team. They were, you know, we all pulled together. We got a lot of things done. You know, we helped some animals and stuff like that. So even if it's not necessarily like in the flow of appointments or something like that, there's usually something that's positive there.
Well, and I think usually it's more good than bad.
I would agree.
Really,
I would agree.
Really, truly.
Absolutely. And, you know, we do talk a lot about the, you know, kind of the horror stories of veterinary medicine and all the things, all the challenges that it can come with, which are very real and, you know, they can be overwhelming. But I think we've said this before when we've talked, I still have no regrets.
None.
I still love being a vet.
No, that's, you know, in grand schemes of things I've done wrong in my life, becoming a vet, that's not on the list. That's not on the list.
Long, but this one
no, that one's not on it. You know, and it is really interesting because I think lately too, we've seen it even on social media when there's been, you know, we've done a good job about getting the message out. I think in a way that our industry does have some issues in regarding things like mental health and the busyness. So it is interesting to see it that when there's been some social media, quote unquote, backlash at vets, I think it really is important to click on comments sometimes. And I'm not a big fan of
the comment section.
Like, don't go down that rabbit hole on Facebook. Don't click on the comments. Don't click on the comments. But every once in a while, I do click on the comments because the thing to take in those comments is that for every person who's on there, like supporting the negativity, there's probably 10 more, or sometimes it's even overwhelmingly positive, where, you know, somebody posts something horrible on social media and you have like this like slew of clients come out and be like, no, you're wrong.
Yeah,
they're great.
Actually,
they're wonderful. Our vet is wonderful. You're just being unreasonable. And I think people are starting to kind of see through some of those in a way. They're like, no, you're kind of a jerk and you're being a jerk. I'm going to call you on it. You know?
These tirades, you know, these long threads of social media bashing, in addition to other clients and other people coming in and saying, hey, no, you're being unreasonable. I've also seen like floods of our colleagues showing up and going, hey, let's actually reframe this and talk about what you guys are doing here and what's realistic. And you're not gonna convince everybody, but I agree with you. There does seem to be this flood of like, hey, no, we're not gonna have this lynch mob mentality.
Yeah, it's a little bit of we're not gonna take it too. Like, and not in a negative way, not in like we're gonna be real, like, you know,
snarky,
or mean or anything, but just, you know, no, you're wrong. Like a polite correction.
The customer is not always right.
Yeah, or just a little bit more like, no, that sounds like you got excellent service and things went wrong because things go wrong. Yeah. So I did hear about a vet recently too who did manage who took someone to court, did some legal, you know, it was like, hey, what you're doing to me is defamation, and actually got the person to take down the video and post a retraction. And
that's amazing.
It's good because I mean, you know, we've been told for years, oh, just ignore it, it'll pass, which it does, but I think that's not always, you know, I think there is something to be said for, and again, if you do it in a positive way, if you're not like, look, I'm not going to stoop to your level, I'm going to actually do this and be nice about it and just say, you know, make a correction. I think that has really empowered us, especially
just reframe, show the other side. And you know, it just letting them show the caring, kind, intelligent, capable professional that they are.
Yeah, I mean, it draws on our strengths in a way, right? You know, part of being a vet is developing this high level of empathy. So, you know, and I think we all do this. It's sometimes, like you said, it's sometimes hard to get to, but a lot of times when people are angry at us, I think part of our problem is we understand like where their emotions are coming from. So we're like, oh, you're really angry because things went wrong. And I think part of us still goes, oh, I couldn't have done anything to fix it, but you still have this deep degree of empathy for them. So you want to make things better. But it is a matter of, like you said, reframing it. Like you can feel bad for people and still hold them to task for their bad behavior too.
And perhaps in that reframing, it kind of allows a mental reset on our part to say, because, you know, God forbid something does go wrong, I think, that high degree of empathy, our first reaction is to be like, I did it. It's my fault. This is something I did. And whether or not it is, which the majority of the time it's not, was there really anything you could do differently in that moment? Well, you don't know. I mean, it still could have turned out the same.
And again, some of that comes from, we're professionals. I think we hold ourselves to a very high standard,
right.
Which not a bad thing to want things to go right every time, even though we know biology doesn't work right every time. It doesn't matter.
Not every animal read the book.
Yeah, we want to beat the odds, right? Like we want to beat the odds every time because we've seen patients beat the odds. We've had those good experiences. So you're like, why not this one? Why couldn't this dog get better against the odds? Why can't, this gerbil survive?
And it doesn't matter that, you did it with like $50 and a popsicle stick. You still want it to work.
You still want it to work. Exactly. You do. Because again, every once in a while we get something that beats the odds. And so you hold yourself to this incredibly high standard. And I think, like you said, that self-reflection, yes, I understand where you're coming from, but that self-reflection, I think, also gives you a chance to like be really realistic too. To go back to that place of science.
Look at all the things we did do.
Yeah.
Look at all the things we did right. And then this thing went wrong. And there's probably nothing that could have stopped that because we did everything by the book.
Yeah.
According to how we should.
Yeah. So that's I feel like that's been a really good, and I feel like that's recent too. I feel like this is really starting to pick up even more momentum in the last like 6 months.
I think there started to be a little bit more awareness of the damage that these social media tirades can cause to human beings
in general. In all industries.
In all industries. And then of course, the public awareness of the high suicide rates in our industry and stuff like that. And just, I mean, it's like anything, right?
Yeah.
Like awareness is the key.
Knowing
what is going on. And having a full understanding of the whole picture is what makes everything better for everybody.
Yeah.
All right. So awareness and awareness for ourselves and maybe a little bit on our clients and patient side as well.
A little more on the public side too.
Yeah,
for sure.
Absolutely. Another thing we talked about was and this is something a term that I really like that I've heard recently is the change from standard of care to spectrum of care.
Yeah.
I love that shift.
So nice and flexible.
It's so nice and flexible because I like to practice, I tend to practice a little bit more rural and so I see all kinds, some of them I get to refer and they get all the bells and whistles and, we do all the things and it's great. And other ones are, what you see is what you get. You get this opportunity to fix the animal and you do the best you can. So getting away from that, if you don't do it this way, you're not up to the standard and you can fall on a spectrum.
Yeah. I hope that makes us all feel a little bit more empowered. I think some of it comes from this fear of not meeting that high self standard we've created for ourselves.
And then when there's another standard,
and then I mean you get into the fear of the legal fears, the board complaints fears, and all these fears. And I think I love the idea of spectrum of care because a working emergency, kind of similar to rural, not everyone has the money to do the big. I mean, emergency care it's going to be expensive.
Absolutely.
There's some limits to what we can do on emergency as far as costs go. We can try and keep things low cost, but there's still going to be more costs.
Absolutely. It turns out you have to pay people more to get them to work in the middle of the night.
Yes. but it is interesting because I think one of the things that I realized working emergency coming out of school is it's important to learn that big gold standard, right? Like the ideal world stuff.
Sure.
But especially working emergency and again, just things being costly and things like that. I think one of the big wake up calls for me was I had a client one time and it was a young puppy vomiting diarrhea, really worried about parvo. I worked in an area at that time where there was a lot of parvo. We did a parvo, they could afford a parvo test and it was negative. And I was like, whoo, okay, hopefully that's real.
Hopefully we're not infecting everybody.
Yeah. But the good news is like, they ended up not having a ton of money. I think we gave sub-Q fluids and I want to say we just gave the dog like medical bromide because it was they had parvo test money and a little bit more.
Sure.
A little bit, not a ton. And it's funny because of course being a vet, I ran into them at like a party
Of
with some
course.
friends of a friend, and they were like, "Hey, you were that vet," and you're at the moment you're like,
Did the
Okay.
cat live?
"Okay, I am that vet. Are you happy with me?" And she's like, "Oh no, you were great. My puppy's
Aw.
fine. It was great the next day. We think it got into some garbage after all. We found it later." And so yeah, fluids,
Oh my
fluids and
gosh.
antibiotic. That dog was fine.
There you go.
And
Yeah.
it was when I was relatively newer grad. And it was
Sure.
that great moment where I'm like, oh, this cost them a lot less money than my first plan.
Right, yeah.
Which I'm not gonna lie, my first plan was like blood work, x-rays,
Mhm.
parvo tests,
Yeah.
hospitalization, the
Of
whole
course,
night,
yeah.
which is good.
That gold standard.
Absolutely.
Yeah.
And then they were like, yeah, no. And I was
That's
like,
not gonna
cool. So
happen.
how about some people with a medical reminder? Fingers crossed.
Beautiful.
And it worked.
I mean, how many dogs are out there with a Serenia deficiency? Like,
Yeah, it was a good moment because it really did emphasize that sometimes that small stuff makes a huge difference.
and I think that kind of goes into us having each other's backs. of,
Yeah.
You got that dog through the night so that they
Yes.
could go get off of emergency and maybe go to a day practice and things weren't
Mhm.
getting better, where it potentially the cost could be a little bit lower. Because like you said, there's
Yeah.
some stuff you just can't control on
Yeah.
emergency. That sometimes it can be a little bit less during the day. And so, just where, so
You're so
GPs
optimistic. A little less during the day. Let's be honest.
A little less during the
depending
day.
on where
I haven't
you're
worked
located,
emergency in a long time.
It could be a lot less. I
Yeah.
mean, it just is.
Sure, which makes sense.
It does.
It really
But,
does.
yeah.
But where now we don't have to necessarily be on call, most of us. There's still plenty of call out there, but emergency vets kind of give us the option to not be on call and get that puppy, put a Band-Aid on it until it can get to me in the morning, and then I'll take back over so
Yeah.
that puppy can live and hopefully do well, and we can have a happy ending to that
Yeah.
story.
Well, like I said, I think to take some of the pressure off, but hopefully, and I'm sure you've heard this too, when you present a treatment plan and it's got costs associated with it to owners. I really try and I think a lot of us do not emphasize, like, if you can't do this, there's other options. And I really try and take, because a lot of them feel guilty.
Yeah.
And that's it's a big burden for them because they feel guilty that they can't automatically do
Right.
the big things, everything. Yeah.
Yeah. My first.
So I think when we start to present this idea of, well, there's options and there's
Mhm.
option, bells and whistles.
Yeah, of course.
And there's option, sometimes
Fluids,
like
medical
B, C, D, Q are how much change do you have in your car option? I actually had a client do that once. So it was
Oh my
like,
gosh.
oh my God. I'm like, I'll
I mean,
find
I'm
$1
picturing
in my
doing
purse.
that on emergency medicine. Like, how much change did they have?
They
in
had like
their car?
$5 in change. in
Oh,
that
okay,
car.
okay.
But,
So like a totally realistic amount.
Yeah. But we were still like, I'm like, and they were nice people.
Of
So
course,
it's easy to like, again, have a high degree of empathy for them and want to be able to like make
Right.
something work for them. And they're like, hold on, we'll be right back. And I'm like,
Oh.
you're literally going out to your car for change. And I don't want to make people feel guilty.
Right,
I don't think
yeah.
any of us do.
Because
so.
they want the best for their pet.
Yeah.
And most people are trying their best
Yeah.
within their means. And I feel like that's most of what we can ask
Mhm.
is, and this goes, again, back to the spectrum of care of not everybody's going to be able to afford the gold standard, but it's not really fair to say if you can't afford the gold standard, then you can't have a pet.
Yeah.
So it kind of lets everybody off the hook of like,
Mhm.
can we find this middle ground where we can all work together and we can offer options?
Yeah.
And a lot of times I'll try to tell clients, if I'm presenting the treatment plan, I say, this is a dialogue. Like, you look at this, you ask me whatever questions you have. If we need to talk about options, I'm here to do that. You don't have to feel like if you can't do this, we can't do anything. Just talk to me. And usually that kind of gets them talking where they're like, okay, well, realistically, this, and this.
Well, and I was always surprised too, because one of the things I did sometimes on emergency, and it's interesting because I did have at least one person be like, oh no, don't do that.
Mm-hmm.
I actually sometimes came back into the room. We presented our own estimates at that point.
Okay.
That's an interesting moment,
I
but
don't like doing it.
No, not my favorite, but
Uh-oh.
that's where we were at that point. I actually would come in for some cases with like 2 or 3 different options. And I literally had a colleague once be like, never do that. They're never going to choose the most expensive one. And I'm like, but that's not my experience, actually.
I agree.
I actually like doing this because I think it showed that I have some, empathy for, that money doesn't grow on trees and that there's options. And I can't tell you, like, no, sometimes people are like, look, I just don't have the money for the most expensive option, and that's good. But sometimes what we do, interestingly enough, is they'd actually, first of all, it's surprising how many people are like, no, do everything.
Yeah, I agree.
Do everything. And people always caught me off guard because it's always the people that surprise me
Really?
that are like,
all these things I can do it? Okay.
But it was always interesting to me because a lot of times what would happen is you'd end up doing, maybe mostly your B option, but with a couple pieces from the best things we could offer, like it'd be like, can we do this, but maybe minimal blood work, or can we do all the blood work because I really want to know, but and it depends on the case, because sometimes it's more important to do the blood work than the fluids, but other times it's like, I don't know, just save your money on the
right. If we're not going to do the fluids, then there's no point. No, there's absolutely.
And it always felt good because it did feel more like a dialogue then. Yeah. Let's have a talk about this. I'm not presenting you an all or nothing plan. Let's have a talk.
And I think that sometimes gets people to that option B, where if you show them just option A, then you might end up with option C. Because they're like, oh, I'm not doing all that. That's way too much money. Let's go down. And they cut everything out that they possibly can. Whereas if you do have that dialogue, you do have that empathy, to say, hey, I get it. You have to keep the lights on. You have to put food on your table. Then, at that point, they may be willing to let you get more information than they would otherwise.
Well, and I think some of it too is they understand that the costs are the costs. So now we just have to make choices about where we're going to devote our resources.
Right.
Rather than it being like a discussion of why does X cost this much money?
Right. Oh,
because that's the worst, right? Yeah. Because there's mathematical formulas and inventory. I don't get it, but there are reasons we do what we do, and that's not the time to discuss.
And I do love that. I like the way you put that. The cost for the cost. Now we have to figure out how we're going to allocate our resources
in the best way possible.
Exactly. Yeah. And I do like talking to clients about not about allocating our money or about allocating anything like that, but more. I like calling them resources because it's not just the money. It's not the time and how compliant the pet is going to be with treatment, and can we hospitalize, or are they going to like bark their head off and throw themselves into this huge anxiety fit if we do that. So it is resources, like between our time, our energy, the money, everything like that. How do we make it all fit together to get you to the next step? So
series of good choices.
Yes, which I wish I had more than my life. A series of good choices.
A series of the best choices in the circumstances.
That works. I'm just trying to think of like the times in my life I made series of good choices.
I'm going to change this now because I want to talk about one of your good choices. Because you changed your jobs a couple times, and now you've done something. It's sort of old-fashioned, but it's back in style. So it's a good thing that it's back in style.
Oh yeah.
Let's talk about house calls.
Let's talk about house calls.
That's again, this is a good paradigm shift because we're seeing veterinarians that maybe it went out. It was not a good practice type for a while. Things were challenging, and now there's a shift. Right? More and more people are just doing house calls. So.
Absolutely. I think it's growing by leaps and bounds. Probably some of that had a little bit to do with COVID, like, pushing things forward.
I feel like it was even before, like there was a little bit of shift.
I agree.
And now I think it's gained momentum.
Right. Yeah. I totally agree. So I was not a big believer in house calls. This was like kind of a necessity thing.
Okay.
We talked about in a previous podcast, I was a vet without a hospital.
Yeah.
And I first kind of dipped my toe into the water with house calls, and really I was like, I like the clinic. Like the clinic's my safe space. I was just used to the flow of that. But again, I kind of kept going down that road, partially out of necessity.
Yeah.
But the more I did it, the more I really enjoyed it. Now, I will say, like, for as far as house calls, I see a pretty small clientele. And so that makes things a lot easier. But the behavior that I've seen with pets on house calls, oh my gosh, like it's changed the way I practice completely. It's amazing how many things I can do, just me and the pet sitting there on my lap, like hanging out, talking them into doing stuff. And if I can't, then there's a lot of gabapentin and trazodone involved. And we come back again another day.
Medications are a good thing.
Yeah. And so the way where I've landed is actually a hybrid model.
Okay.
I get to, treat these pets at home, which let me tell you about one of my greatest success stories. I actually saw him this morning for a Cytopoint shot. And he's like an 8-pound little schnauzer. He's the funniest little thing. And he hated coming to the clinic. He just didn't like the smells. He didn't like the sounds. From the time he was a tiny puppy, he would just shake. He didn't like it. To the point where even when I would go over to this friend's house, this dog wanted nothing to do with me.
Yeah.
I was associated
with the clinic. Yeah.
It took about a year of doing house calls, like fairly frequent house calls. And we're talking Cytopoint here.
Yeah.
We're doing them a fair bit. But a year later, like I walk in the house and he runs right up to me. I can hold him. I can give him shots. I can look in his ears. And like the biggest thing, it happened this morning where it just warms my heart every time, is he came up and he was sniffing around in my bag and I just put my hand out to pet him and he just stood there. Like he just 8 pounds, right? He's little. So his natural instinct would be to like, whoa,
yeah.
And he just stood there and was like, okay, pet me. And I was like, oh,
yay, finally.
It's just wonderful. And it's changed the way that I practice in the clinic too, because I've seen the potential for what you can get these pets to do without having to do any manhandling.
Yeah.
You can really just convince them to let you do it. And I feel like we can do it in the clinic a lot too. And I'm lucky enough to be a part of a clinic where they work really hard to do that. And we have a lot of positive experience.
Well, and I mean, that's a fun thing too, because there's granted, we're all big fans of medications and,
sure,
better living through chemistry at times, but
absolutely.
It is pretty remarkable, the paradigm shift to, just deal with fear, aggression, and, reactivity and reduce that in the clinic. I wish they were better about it in people.
I know.
So many people have so much medical fear and medical trauma. And it's great because it's one of those things, and I think we've talked about this. Sometimes I like looking at what the human medical industry is doing, just interestingly enough, but this is one thing I actually feel like veterinary medicine is doing certainly more actively and certainly more widespread than human medicine, is addressing like fear, aggression, trauma associated with medical practices. And more of our pets are now, or more of our practices are, really working how to do medical care without it being traumatic to the pet.
Just having the pet on your side.
Yeah.
I was talking to somebody about this and they said, we've gone from, instead of like trying to shove the animal into our box of what we need them to do or be at that moment, instead convincing the animal to go into the box themselves. And, I'm going to stick you with this needle. I need you to let me do that. And they're like, nope, okay.
To make it happen.
Right.
How can we work on this? Yeah.
And I mean, how many cats with, initially bringing them into the clinic and they're on the ceiling and they have 8 legs that are coming for your face.
Yeah.
And then, with some gabapentin, some feel away and some churu and the Calm and Cozy cat wrap. I don't know if I can say that because it's a specific product, but oh my gosh, I live for that thing. You just swaddle them up and feed them some churu and some feel away and they just kind of purr away while you stare with needles.
I mean, it's great. I mean, we basically, because again, I do exotics, we're living the bunny wrap cilantro life over here.
Okay.
Yeah,
all right.
It's amazing how many of our clients come in and they're like, oh no, he loves his meds. They're strawberry flavored. He's coming to look for them. So rabbits can get used to being given medication too. So
what the cilantro though?
The cilantros are kind of, so, dogs get, the peanut butter or the squeezy cheese for exams. Cilantro for rabbits and guinea pigs. Because it's got long stalk. They love it. It's really aromatic. So it's got a great smell. Plus it's nice. I don't know. It's kind of nice for us to smell.
Absolutely.
No one in our clinic thinks it smells like soap. So we're very lucky.
That's good. No weird genetic things going on.
Well, I mean, I don't know if it's even, I think it's
pretty
weird.
Common.
I
don't think it's weird. I think it's probably like 50-50.
But it's got, cilantro is great because it's got a long stalk and it's really aromatic. And most of them look at it as like a treat. It's fun.
No
So
kidding.
plus it's sort of funny to like feed them the one end and see it get sucked up into their mouth. There's the humor aspect of it that keeps it all like light and enjoyable and kind of fun. So we're definitely seeing more of that even.
Do you wrap the rabbits too?
We do. We do.
So they don't
bunny
kick out.
burritos. Yeah.
Okay.
It's safer for them too. Yeah,
Right.
For sure.
I do remember that. From
But I
school.
mean, I look at zoos doing all this amazing, target training with fish and reptiles and their great apes. And, it's just seeing, literally the animals cooperating in their own care is really fun and good. And plus it's kind of nice for us too, because like, we don't want to be the bad guy.
Absolutely.
We never do.
Yeah, it's been a huge boost for morale in general, no matter what aspect of the industry you're in. Dogs and cats are exotics and zoo, whatever it is.
Yeah.
Where when you can be not, like Tucker, my little schnauzer, when I don't have to be that scary.
You're not scary person anymore.
That's
You're the
like,
friendly
well,
person.
I have to be the scary person because I have to do these things to you. Instead, it's like, hey bud, can you work with me?
Yeah.
It's so much better for everybody's just morale.
Oh, it feels good too.
The clients
it feels
too.
good. It feels good to everybody. It feels good to our techs, our assistants.
Yeah.
It's just and of
and you
course,
probably see more pets that way because people are more willing.
Clients don't feel like it's a traumatic experience. They like love it. They're like, oh look, my rabbit loves going to the vet. My dog thinks the vet is amazing.
Yeah.
And I mean, we always had a handful. Let's be honest. There's always a handful of dogs that are like, I love being here.
Yeah, that's true. Those have always existed, but there might be more now.
Yes.
Yeah.
Yes.
They're like, you're gonna pet me and give me snacks, okay? And, I don't know, when did that shift happen? That change from, look, we just got to get it done, hold them so we can, give a shot or whatever.
I think it's been gradual, but I do, I feel like definitely the last decade. It's not brand new, but I think because we've been able to see it be successful and we have more science to back it up, and now we also see that it's better for the animals too, and it's better medicine. It's really better medicine. I think again that momentum has grown, and more of us as professionals, again, whether it's veterinarians or technicians, just we want that because we want. I mean, we got into this. Let's be honest, we're all like animal lovers.
Yeah,
and we love science. We love animals. And being the bad guy sucks.
It does.
It sucks. Really, we don't want to do that. We want to be the good guy.
I've been the bad guy, and intentionally or unintentionally. And it's just
and sometimes it's unintentional and it sucks.
It does.
So we want to be the good guy.
And so being able to do that, and then I think it causes us to set the expectation with the owner to say, I'm not going to, when they say, oh, I don't want to come back again, just give it to them or whatever. I say, we don't do that.
Yeah.
I'm not going to manhandle your pet.
Yeah.
I don't think that's good for anybody.
Yeah.
And where we just kind of off the bat, start having that conversation about how we're going to lower stress
levels.
levels.
And to be honest, I think some of it too is coming from owner demand.
Sure.
Like they don't want that anymore. Like they love their pets. They want them to be happy. So when they go someplace and it's a good experience, not just for them, but like for their pet, it's just better.
100%. I mean, how many times have you heard like, oh, they start shaking as soon as we get in the parking lot, or they start shaking as soon as we get in the car because they know they go to the vet, and it's still going to happen to a point. We can't fix it all, but I feel like it's greatly diminished.
Way better,
and just a lot more dogs that maybe they're not the come and give me snacks. I love being here, but at least you can handle them without a muzzle.
And again, safety. I know some people were really nervous about it being unsafe at first, and I think that there's still some pets where you're like, there's not enough medication in the world to make me handle you without a muzzle. 27 trazodones and 400 gabapentins. Like we need to be safe too, but I think there is this evidence now that it is safer, and that makes us feel good too, because no one wants to get bit.
No.
So,
but if we, and absolutely, I still do use muzzles.
Oh,
I'm not here to lose my fingers or anything, but if we're not manhandling, maybe we're not getting like head butted or scratched across the face, and
backs hurt because we're picking up dogs that are flailing or upset, and patients getting hurt too. So that's
using safer sedations and stuff like that when you do have those that you just can't handle. There's nothing you can do.
It's nice to have more options there.
Absolutely.
A lot more pills,
Yes.
oral options these days. That's been a good thing.
Absolutely. Yeah. Rather than like, okay, well, we have to give them an injectable sedation. We still can't touch them.
Yeah.
What
Still
are we
can't
gonna
even get
do?
close.
Yeah. I've never listened to this dog's heart. Hope
Fingers
go.
crossed. Yeah.
So that's been a huge one for me is,
Yeah.
you know, we talked about the house call stuff, which, you know, there's a huge variety of house call that's from full
Mhm.
practices. It's not me, but there's another veterinarian in this area who does, I mean, it's amazing the things that she is able to do on a house call basis,
Yeah.
and just the resources and the way she does it. It's amazing. So there's these full service house call practices. There's, you know, something like me, that's a little bit more of a hybrid,
Yeah.
just specifically in-home euthanasias.
Yeah. And hospice care.
Hospice care.
I
yeah.
mean, you know, and there's so many more options.
Mhm.
It's amazing to me. There's more positions, there's more jobs for us in industry. There's more jobs for us in government. There's more jobs for us in labs. There's more specialties.
Mhm.
There's more, I mean, there's more types of practices. It's remarkable. I remember one of the things I went through in school, and granted, I went to school a few more years before Cassie, a few.
I mean, at this point, that gap is like starting to close.
It is a little bit. It's funny, but I was always told, oh, you know, it's great that you love exotic pets. That's fantastic. That'll never be your whole career. Focus on dogs and cats. And I'm like, okay,
Gosh.
cool. And yeah, you know, I like all animals. So I was
Sure.
one of those people. I was like, I probably would be happy being a horse vet, even
Oh,
though
yeah.
I don't really, I'm not comfortable with that. It's not my MO. Like if I had gotten to practice medicine on horses and that was my only option,
Mhm.
I still would have chosen that.
I agree. Yeah.
But I'm like, which by the way, yeah, don't ever have me do that. 'Cause that's, like my last equine medicine was in school. I'm not gonna lie. Like I'm in awe of them and all that they can do too. But I think it's really cool. Like I work for a practice that only sees exotic pets,
That's
that's all we do. And so, but I look through what my friends' careers have turned into and the jobs that they've taken, and you know, working hybrid for a small animal practice with exotics, and then doing some side work with the zoo.
Oh gosh, how cool.
Radiologists that work, veterinary radiologists that work from home,
Mhm.
and are amazing.
Yeah, and we need them all.
Veterinarians that work at home and just talk through diagnostic, you know, internal medicine consults with you, and
the value that we've recognized in those kind of supplemental fields,
additional positions,
especially now when we talk about you know, veterinary shortage and nurse shortage and all these things, to have we're in general practice sometimes doing procedures or handling cases like we never intended to handle.
Yes.
This was not, we were going to refer these, but we can't because there's no appointments until next year, because as much as I, you know, want to stomp my feet and go, but I shouldn't have to do this, it's your case. You know, they're full too. There's nothing they can do about it. And so to have somebody who can really talk me through it and not just, you know,
just
I'm not
jump
just,
on the phone.
Right, exactly. And I'm not out here by myself going like, I don't know. I read this book one time and it said to do
Fingers crossed.
But yeah, so those supplemental services to help us provide more care in general practice, I think are huge.
And I think the fact that I'm seeing our colleagues make careers out of those.
Yeah.
Like that's, you know, they're not doing that for extra money on the weekends,
right?
But they're doing that full time. Like that's their job. It fits their lifestyle. There's all these, I mean, again, we always joke, oh, there's no work from home options as a veterinarian. I am a work from home veterinarian sitting here across from you. Yes, I do some clinic work. Yes, I do some other stuff still, but most of my job right now is at home. That's doing education planning, and I work in my sweatpants way too much.
Amazing. I know you and I have been on calls and you're like in a hoodie and I'm like, oh. Seems amazing. I work in other people's homes.
Yeah, no.
Although, like, I'm complaining. I work in scrubs. I mean, come on.
Yeah, I know. Like when I come to the office, I'm like, ooh, I have to like plan outfits that match.
Right.
Other people will see them.
Because it's not just going to be from here up.
Yeah. Who knew? But yeah, I mean, I do think that I think that's one thing that's actually helped some folks, especially in last year when when you get really down and you just think, oh, I can't do this job anymore. Well, that's okay. You can still stay in this career.
Yeah.
Just do a different job. I mean,
Yes.
there's so many of them. And I know sometimes it seems hard and overwhelming, but I do think there's a lot of jobs out there that folks haven't even thought of.
Yes, that are still yet to come. And
Yeah.
I think that speaks a little bit to division of labor.
Yeah.
So we talk about having radiologists or, internists or specialists that you can jump on the phone with to help you manage a case. There's also urgent vets.
Yeah,
now
urgent care.
Urgent care models, which we just got an urgent care clinic here in Gainesville. And I mean, it's amazing because you give a vaccine at, 5:30 p.m. and God forbid there's a vaccine reaction. Well, they're there till 11 and you don't have to send this patient to the hospital. And
yeah,
so that's been another.
Those in-between cases. They need something now. But they're not really ER cases.
Right.
It's not something that's going to have to stay in the hospital for
and
3
the
days.
ER vets are overwhelmed.
Yeah.
We don't want to send them our vaccine reaction.
They don't want them. They really don't.
Right.
They're like, for reals.
Either we continue to overwhelm the ER vets or we stay, an hour or so late, making sure that we're stabilizing our patient. So having this kind of in between is, I love whoever came up with the idea of creating that in between.
It's great. It's great. Yeah. And that's one of the, I think a couple things, it's crazy is, the COVID years, years is
still to come.
Yeah, are still upon us, obviously, but it's weird. It does take a minute to kind of step out of that and think about the positives, but like we really have gotten, I think, at our clinic, and I think other clinics, and I think as an industry, gotten some positives out of COVID.
Sure.
And again, kind of the division of labor, maybe the use of telemedicine. Certainly it's becoming a little bit easier, and we're learning
a lot of kinks to work out still.
Yeah, but and we're learning what we can and can't do.
Right.
Like, oh, that's not something, what? That's not a good idea. That doesn't work out. We can't do that, that kind of case. But these other cases we can, do. And teletriage. Oh my gosh, that's so.
Oh yeah.
Yeah. The services that are like, you don't need to go to the vet.
Yeah. So let's talk about those because, maybe I'm wrong here, but my perception is that sometimes those can get a bad rap.
Yeah.
Sometimes for legitimate reasons, sometimes not. And I think the concept in general, and I'll be honest, I don't have a ton of familiarity with them, but I think the concept in general is good.
It is. Yeah. And I know a couple of folks that use, there's a specific service that's associated with their clinic. So like they kind of can talk clients through that. Do I need more?
Right.
Versus am I panicking moment.
Right.
And if it's associated with the clinic, there's it's weird fee structures and they're all different. So I can't really speak to that, but I do think that's kind of nice because so often your receptionists are the ones doing teletriage. Yeah. And it's great. Some of them are really knowledgeable, but I don't know about you guys, but still phones are still ringing off the hook.
Right.
And just getting,
and one of those might be no, you need to come right now.
Yes. But some of them are more, just like, no, let's make you an appointment in 2 weeks or, no, don't come in for that.
Right.
Don't.
It'll be okay.
Yeah.
My dog had diarrhea one time. Have you ever just had diarrhea one time?
Yeah. I think let's talk through this.
It'll be okay. At least in the morning, it'll be
and
okay.
I do think we're seeing some structures, you're right, there's still kinks to work out, but I think one of the positives, we're seeing some structures that are working. So, services that are tied again to a specific clinic, a clinic that specifically uses a specific teletriage service.
That they're comfortable with.
Yeah, or specifically has telemedicine appointments that they do for certain things.
Sure.
They've worked out kind of those criteria, which ones they are, don't even offer.
Right.
Like you have what problem? No, you're coming in. Like, you're coming in for that. Sorry, but no. Versus, no, I saw you 2 weeks ago and you really just want me to look at the same spot again.
Right.
Let's make a phone call.
Yeah.
And let's, compensate everyone for their time and in a fair way, but hopefully it's getting easier to figure those things out, I think.
And that might play into kind of technician and nurse empowerment and like you talked about receptionists doing some of the teletriage, but even some of these maybe talking about nutrition or behavior and stuff like that, obviously under the guidance of the veterinarian who's made the diagnosis and is doing the management, but a lot of that client education stuff really, when we're talking about either teletriage or just kind of division of labor, but really these paraprofessionals who are so valuable to everything we do, we can't live without.
Yeah. And I think the time has come, and it's come up in a really good way. Like, all right, we really have to talk about, these are professionals. They are professionals. They have their own profession. It's not just a stepping stone to becoming a veterinarian.
Right.
Being a veterinary technician or a veterinary nurse is its own profession. A lot of people chose that profession because they want to be that in that profession.
Exactly. That's what they
and
want
that's
to do.
awesome, because they should be. And now, let's make sure we're utilizing them for all their training. Let's get them involved in those behavior consults. Let's get them involved in those nutrition consults, because we can't be everywhere. We don't have time to be everywhere. So
if you don't feel like you're being allowed to work to your fullest potential, go and talk to your veterinarian, because chances are, if I'm not asking you to do something, it's because I assume that you're busy and you don't want to. And I'm trying to be nice, and I'm trying to say, I will do it so you don't have to. But if you want me to just get out of your way, feel free to tell me that. And that probably goes for a lot of us.
I had that moment where I was like, here guys, I'm helping you. And they were like, stop helping. They were like, I think I was cleaning up after surgery, and they're like, no, you're putting everything in the wrong place. You're not cleaning. Stop helping. Go help with your paperwork in your corner.
Yes.
Stop helping. So
I did. We had, we actually ended up with a complication under anesthesia the other day. The dog was fine. Everything ended up being okay. It was a really bizarre case, but, the technicians I was working with commented, because I was like, I'm the guy who will like crank down the gas until be like, yep, can't go any lower than that. We're gonna have to run it
like thanks
until I know the absolute lowest Mac that I can use. And so we had this thing, and I was like, I wasn't even touching him. I was over on my side of the room. They're like, you did so well staying on your side and not
in your
bothering us.
Yeah, and I mean, I do think some of it, like, we're trying to be nice and help, but actually, I think what we're doing is getting in their way.
Probably. So that's what I'm saying. Like, please tell me
if we're getting in your way. Just gently, gently nudge us. Yeah. We take hints.
Truly, it's a relief. Like, if I have one registered vet tech, and she will come up to me and she'll say, hey, you have this appointment. I can just go talk to him about this, and this. And I've heard her spiels. I'm very comfortable with her explanations. And it's such a relief to me to go like, okay, that sounds great. Yeah. Whereas I would not ask her to do that, because I would feel like I'm putting more on her plate. She's busy and all that.
It's about communication. Right. But we have one tech who's like really, really good at cytology. Like, I should not be reading any slides or any peoples or anything.
I should not
either. When they're in the hospital. And it's a relief. Like, it's like, oh, we're done with that because you did it, and now I can be done. Now I can do my job where I prescribe meds for the results of said, or get a treatment plan together, or talk about surgery.
Such a relief.
It is
like, oh, I can just do my, like the day I found out that I don't have to do the urinalysis and read the sediment, I was like, oh, thank goodness there's somebody who's better at this than I am.
So I mean, I think that's something that is really positive, and I think it's growing, and I think it needs to continue to grow.
Because we all have different strengths, right? Like, I'm terrible with all things microscopes. I can muddle my way through, but I really don't enjoy it, and it's not my strong point. It's a challenge for me every time. And so if there's somebody there who's good at it, like, I'm
gonna let you be good at it.
I'm gonna let you be good at it, because I'm good at this thing over here, so I'm gonna go be good at that, and you just tell me what you have. Like, just let everybody.
Well, and so this is a great one. This is another wacky exotic story. So Cassie and I were just talking about this. I just did surgery on one of my own fish.
Yes.
So very excited, good case. But it was really funny because when it came time for the anesthesia, I literally just looked at my tech and I was like, the usual. And she was like, just the usual concentrations of MS-222. You're comfortable with all that. We're going to do this and this and this. And I was like, yep, exactly what you said. All the things that you said.
We're going to do that.
Yes. And I was done.
Yes. Oh yeah.
I was done. I was like, I know what she's talking about. I know what the usual doses are. I know she's on it. And we got surgery done. We did get a CT done. I'm not gonna lie. That's my brag point for the year.
Yeah, I saw the CT. It's
really
cool.
exciting. Really exciting. We got our CT. We got surgery done. The fish recovered. He's doing great. This is so cool to me. The fact that I can't that again at my little clinic that we could CT a fish. Again, we were so excited about that. We were so incredibly goofily like jumping up and down, like literally jumping up and down.
Oh yeah.
Literally jumping up and down,
Absolutely.
excited. We're like, look, it's working. And you know, the images pop up and you're like, oh my God.
Yeah.
Oh my God. And yeah, but I think that's happening for everyone to some degree. I mean, maybe not CT, but maybe, you know, digital cytology and, you know, in-house blood analyzers. I think it's so cool that it's not just that, you know, of course the technology's cool, but like, I like the fact that like, I can turn around to an owner and be like, I have your blood work right now.
Yeah,
right now.
I can tell you exactly what's going on with your with your pet right now. Like your pet is, I was gonna say diabetic, but sometimes that's a one touch.
Yeah, sometimes you walk in the room and you go,
yeah. Oh, it's so not me.
You can smell it.
But the owners will tell me, they'll be like, they have a weird odor. I'm like, tell me more. And they're like, it's a little fruity. I'm like, oh, we're diabetic. Okay, got it.
You can smell that genetic skull again. Yeah. I mean, it is. I get excited all the time about cases like that and new stuff we're able to find in the clinic. And you know, it's just remarkable.
And so this is kind of taking me down another rabbit hole, which we may elect to just edit out of the whole final product. Okay, so we're talking about like, you know, digital radiology and CT and in-house blood and digital cytology and playing to everybody's strengths and stuff like that. So at this point, with the model we have in veterinary medicine, every single clinic has those things.
Yeah.
I see that as a bonus.
Yeah.
Because I don't like it that in human medicine, they're like, okay, you need blood work. And I'm like, okay. And they're like, no, go over there, make it. Oh, so you're right. At my GP, I can go down the hall, but
or go across the street or go across town.
Yeah,
or schedule it for another time.
Schedule it for another. And you're like, oh, I got to do something else, and I got to do, or like, you know, well, you can get it here, but the phlebotomist isn't here, and you have to do another day. And you're like, this is a whole building full of doctors. Like, I don't understand.
One of you draw my blood.
Yeah, none of you can stick me. And so I don't love that aspect of it. That, you know, oh, you need an MRI. We'll go schedule another appointment. But at the same time, like I understand like some of the inefficiencies that come with every clinic having all of these technologies.
You know, and I mean, you're right, but it's always really interesting to me, especially now that we're in this shortage time. I've certainly heard from some GPs, like, you know, kind of what you were talking about, like this idea of, oh, I'd refer it away and now I can't. So in a way, it's brought us back to kind of that basis of veterinary medicine being the doctor for everything. Right. You are the dentist, you are the dermatologist, you are the neurologist. And I still think there's incredible value in a GP being, you know, and I understand about, like you said, somebody's really good at dentistry. Sure. Eyes freak me out. I'm like, well, something has, I think we've talked about this before, conjunctivitis, and I'm like, you should probably see someone else. Right. Yeah, like any other veterinarian. Any of them.
I have to tell you the story. Any of them. I had a dog come in and he was meant to be on another doctor's schedule and they thought she was working this day, but it was me. Okay. And so it came in for a mass removal, right?
Oh gosh.
I know, I don't really do those anymore.
Okay.
But you know, I'm not inept. Okay. Like I can do a mass removal. So I was like, all right, so this thing ended up on my schedule. That's interesting. and it was for one slot, meaning there were like multiple other procedures that day, and I had to be like wrapped up by a certain time. So I was like,
to go. Okay,
this is going to be interesting. And then we went to click on the estimate, and it was like schedule multiple slots. This is going to be really long, and I'm like, this just keeps getting better. Like, all right,
what has gone wrong?
The dog came in, and thank God, the owner was like the nicest human being on the face of the planet. But this mass was bigger than my head.
Oh gosh.
It was the entire lateral aspect of the dog. So he was just the nicest person. And I had to go to him. I was like, so I think you were meant to be scheduled with so-and-so, but I'm here. Can we reschedule this?
This is a mistake.
I would like to lie to you and say I'll attempt it, but nope,
I won't.
Yeah, that one's well out of my comfort
zone.
And
I think, you know, even in the GP world, like I love surgery. I'd be happy to do that mass removal. Oh my gosh. You know, but I hear more GPs like telling me they're doing in-house cytology because the owners need answers right away and they can't just refer it away. Or they're doing more in-house surgery because, again, there's no place to refer somewhat urgent case of foreign body obstructions, things like that. Like they're like, we're not relearning, but like we're having to really truly get back to those roots of being a jack of all trades. Because, you know, we have to reserve specialist referrals for things that are really truly
that we
Special
really can't
cases.
do.
Yeah.
And I go, nope. Like that one where I was like, no.
But see,
but there was another GP who could do it.
Yeah, exactly. So, I'm probably not the one to be working up your dog for a dermatology problem because I've never done that. But there's so many great GPs that are really, really good at dermatology and could do not just an adequate, but an excellent job. Yeah. So I do think that's one of the things that's very new, COVID associated, shortage associated. That's actually kind of a good thing for our industry to retouch those cases and feel more comfortable and it kind of goes again back to that spectrum of care. Well, you could go to the specialist, but I could take care of you too.
This.
Yeah, I can do this. Yeah.
I remember I was listening to a colleague on the phone the other day and he was talking to an owner and I heard him say, so, a lot of the resources say to, refer these cases and it was actually dermatology cases. They have it managed by a dermatologist.
Yeah.
And it was clear from the conversation that, that just wasn't something the owner was interested in doing, couldn't do.
Yeah.
Right. And so I heard him say, look, this is what all the references tell me to do. I'm not saying I won't manage your pet. I'm just saying I want to do these additional tests so I know exactly what I'm treating. And I thought that was such a good way to handle it of like, I can still provide this service for you. Can you meet me halfway in this way? Like, can you do this additional test that I really need the information in order to treat properly?
To really give me, and I think if you present it to this is going to help us get the best results.
Right.
We're not just doing this for academic interest.
Yeah, we're not just curious.
Yeah, this is legit gonna help.
If we're gonna manage it, this is how we're gonna do it.
I mean, the thing that I think is important though, and we talk about, going into the year in a positive way is I look back at what you said to start off. We still have so many clients that they're the best.
Yeah.
They're the best.
Just good humans.
Yeah. And I think if we, as we go into the new year, I think that kind of a renewed focus on there are people that love you out there. If you're a veterinarian, you have some clients that legit think you walk on water, think you're an amazing person, love you. And I think if you keep that in mind, you really, it does keep us in a really good, positive, good, happy place.
Absolutely. Absolutely. Focus on those good clients.
Yeah, let the squeaky wheels go. Let them roll down the street.
Yeah, exactly. Let them go. And then, really, maybe patting ourselves on the back in this spectrum of care that we keep talking about of the things that we have discovered that we're capable of handling that maybe we weren't comfortable with before. And, just the progress that has been made with us as individuals and then as an industry in general.
Yeah, take credit.
Absolutely.
We deserve it.
Absolutely. Absolutely. Well, Dana, this has been a blast as always. I mean, do you have 3 more hours?
No, we gotta cut it out. Yeah, at some point they're gonna turn us off.
Yes, exactly. They're gonna cut off our microphones. So thank you to everybody listening. This has been great. I hope that it sends you into the new year with some positivity.
Yeah, happy 2022, everybody.
Woohoo! Gosh, 2022. I can't believe it.
Scary.
We were so eager to get away from 2020. Now it's 2022.
I hope you guys had as much fun with that episode as we did, and I hope in such a challenging time for many fields, including vet med, maybe that added a little bit of positivity. Thanks again, Dr. Varble, for joining me. It's always a blast, and if you guys enjoyed that, I'd keep an eye on social media because there may be a few more hijinks between the two of us still to come. As a reminder, if you'd like to find out more about this and other podcast episodes, click on the Education tab on the Vetfolio website. As always, we'd love to hear your input on this session, as well as ideas for topics you'd like to hear from us in the future. Feel free to reach out to me at dvm@vetfolio.com. You can also visit my Facebook page at Dr. Cassi DVM, and you can find me on LinkedIn. And remember, if one animal is better off because of you today, it's a great day.